Spinal cord injury by Keyur Patel. What is spinal cord injury? It is relatively low incidence, high cost injury. It is cut out of nerve at and below the level of injury in spinal cord. Paralysis of muscles below the level of injury, changes in body image and sexual function, incontinence and having rely on other to complete everyday tasks. How does injury occurs? There are some mechanisms such as falls, transport, sport, assault and others which cause spinal cord injury. Demographic and etiology. According to Rick Henson Spinal Cord Injury Registry in Canada, over 86,000 people live with spinal cord injury. For the 1,389 people who sustain a traumatic spinal cord injury each year, the annual cost is estimated to be 2.7 billion Canadian dollars, including both direct and indirect cost. According to Rick Hansen Spinal Cord Injury Registry, average age of spinal cord injury patients was 52-year-old in 2019. 78% of patients were male and 22% were female. What is the severity and level of injury? Tetraplegia or quadriplegia is complete or partial loss of sensation and or movement in the arms and typically in the torso and legs. On the other hand, paraplegia is complete or partial loss of sensation and or movement in the legs and often in part of or the entire torso. Injuries where some motor or sensory function is retained below the level of injury is called incomplete injuries, which were more common than complete injuries which have a total lack of sensory and motor functions below the level of injury. Incomplete tetraplegia was the most common type of traumatic spinal cord injury sustained among Rick Hansen spinal cord injury register participants. In this in this slide, you can see the difference between incomplete and complete spinal cord injury. In complete spinal cord injury, there is no sensory or motor function is retained below the level of injury, while incomplete spinal cord injury shows that there are some sensory and motor functions are retained below the level of injury. This chart helps neurologists to define the level of injury in spinal cord, which is very crucial for us to design exercise program. Asia impairment scale is very important to define the injury type, like is it either complete or incomplete. It is divided in ABCDE scale according to how many key muscles are preserved below the level of injury. There are some clinical syndromes such as central cord syndrome, anterior cord syndrome, Brown-Séquard syndrome, posterior cord syndrome, and cauda equina. So in B image, you can see the only the central part of spinal cord is affected, so it's called central cord syndrome. C image show Brown-Séquard syndrome. In this syndrome, only the half of the spinal cord is affected, so only the half of the body part is also affected. D and E image show the anterior and posterior cord syndrome, in which only anterior and posterior part of the spinal cord is affected. There are some complications of spinal cord injury such as autonomic dysreflexia, pneumonia, pressure injuries, urinary tract infections, contracture, osteoporosis. According to 2099 Rick Hansen Spinal Cord Injury Registry, urinary tract infections were the most common secondary complication in hospital, followed by pressure injuries and then pneumonia. Special special recommendations for spinal cord injury. It is more important to begin early mobilization and exercise training to prevent pressure sore and muscles which are preserved. Important to preserve and maintain body composition. Exercise should be customized based on person Asia's care. Use task specific exercise to improve neuromotor functions such as gait or balance. Educations about complications to family member or caregiver are very important in spinal cord injury because patients spend most of the time with them. Here there are some resources from where I have taken this information. I hope this information will be very helpful to you guys. Thank you.